So to start, again, welcome to this session on memory care or memory loss in the Desi community. My name is Selena Shah. I'm the founder of Desi Daughters. Desi Daughters is it's a community and resource center for busy midlife professionals who are navigating aging Desi elders. And we are presenting this session today along with Family Pro Health. Vimal Shukla is the CEO and founder of Family Pro Health. And so Family Pro Health offers remote health monitoring devices and services for elders in India, and will be launching in the US soon. And now to our guest speaker, we have Dr. Sanjay Singh. Dr. Sanjay is a clinical professor of neurology at Creighton University. He's been chair of the neurology department for a dozen years. He did his residency at George Washington University, fellowship at Yale. He's had numerous national awards, including a Lifetime Achievement Award from the American Academy of Neurology last year, as well as the Lifetime Achievement Award from the Indo Global Healthcare Summit in Hyderabad, India. Dr. Sanjay has written numerous scientific research articles and a book. He's also a frequent speaker at national and international scientific meetings, and he's also given a TED Talk. So he's a renowned expert in his field, and I'm so thrilled that he is here to present to us today and share all of his knowledge and insights and expertise with us. And with that, I'm going to turn it over to Dr. Sanjay.
Thank you so much, Selena, and it's a delight to be here today. And what we plan to do is really, I'm going to talk a little bit about the basics of memory, because we have to understand a little bit about memory to understand memory loss. And then we'll talk about the disorder of memory, which is dementia, which is a disorder of memory that we will address today, mainly Alzheimer's, but I'll touch upon at least the second most common cause of dementia too. And then enfolded into this would be what can the family members do? What are some of the things to keep in mind through this? And if in the end we have time, we'll go over some of the more recent advances, which are quite hopeful, in terms of what we know and what we can do about dementia today and in the near future. So let's move on to why is this such an important topic? So just here in the United States, if we do not find a cure for Alzheimer's, by 2050, it may render us bankrupt by itself, right? Because it will be over $1 trillion to take care of just people with Alzheimer's. So it's a very important topic that we need to address as a society, and particularly in the world of medicine. So let's first try and understand a little bit about memory, right? What is memory? How does it get formed? Where does memory live in our brains? So if we were to look at that, this is your brain, right down here. And you can see the pink is the front of the brain and the purple is the back of your brain. And so it's divided into 4 major lobes: the frontal, and then the occipital and the temporal. The 2 that you should remember are the pink and the green ones, which is where memory is residing. So when you are, say, told a phone number, right, that you have to dial, for the first few seconds to minutes, your memory stays in the front of the brain, in the tip of this pink lobe right here, right? So if there is some damage to this area, that kind of memory will be affected, right? Then for the next few minutes to few years, it goes to the inner part of this green lobe of your brain, the temporal lobe, right? And then after, say, 10 years or so, for the rest of your life, if it's a visual memory, it goes to the back of your brain. If it's a hearing or auditory memory, then it stays near your hearing center of the brain, right here on the side in the green part of your brain. So that's how memories stay. Initially, for the first few seconds to a couple of minutes, they stay in the front of your brain. Then for the next, from few minutes to about 10 years, it goes to the inner part of this green area, which is called the hippocampus. And I'll talk a little bit about that. That's the memory center of your brain from few minutes to about 10 years. And then after about 10 years, it goes to, depending on the type of memory, it goes to the rest of your brain, right? Spread out. So why is this important? Because different type of dementia or memory disorders affect different parts of this, and so they will manifest accordingly. So let's look at this. This is your, this here in the blue is where your hippocampus is. This is the memory center of your brain. And if something happens here, it will affect your memory substantially, right? Another thing about this hippocampus is that it also is the site that gives rise to seizures. Quite a few seizures come out of here, right? And so how did we discover that this region is the memory center of your brain? It was not by design, it was by accident. So some of you may have heard of this person called HM who had seizures, and as a treatment for his seizures, at that time, we didn't know what the hippocampus or this part of the brain did. So they cut both of the hippocampi out, right? Cut both sides out, right? And he woke up with his seizures pretty controlled, but with no memory for the last 10 years of his life, right? And so this was a little disconcerting to his treating physicians. And so they called this lady Brenda Milner, which is a neuropsychologist. And neuropsychologists play a very important role in determining memory loss and memory disorders and diagnosis of that. So Brenda Milner then came down from Montreal, Canada, regularly for the next several years to meet with HM, right? And every time she came down, she would have to introduce herself to HM because HM did not remember who she was, right? Even though he was seeing her almost every month for several years. Now, Brenda Milner was a brilliant neuropsychologist, and so she gave HM numerous memory-related tasks because she figured out that his memory was damaged, one of which was to draw a star by looking at a mirror, right? And so initially he wasn't good at it, but with practice he got better. But he did not remember that he had ever done this task ever in his life, right? There was this other patient, and some of you may have read the book, but Mr. Wearing in England, who had a much more devastating illness where not just his hippocampus, but the surrounding regions were damaged. And so this was a book by his wife, which is called Forever Today, because he did not remember things. He only remembered things for a few seconds and would forget everything after that. So loss of memory can be devastating to individuals. But with Brenda Milner's work, we've come to understand that there are three main types of memory. One is episodic memory, and this is memory of what you ate for dinner last night, right? Then there is semantic memory. This is what is the capital of France, right? Paris, kind of knowledge-based. And then procedural memory, like your ability to drive a car, where you're not consciously thinking about it while you're doing it, right? Or drawing a star by looking at him into a mirror, like Brenda Milner did. Now, episodic memory, what you had for dinner last night, that stays in your hippocampus. That's where this episodic memory is. Where you have your memory, semantic memory, which is what is the capital of France, that kind of stuff stays in this blue region of the brain right here. Again, this is the front of the brain, the red, and this is the back of the brain, right? So this blue region of the brain is what gives you semantic memory, essentially what's the capital of France. So if you have damage here, that's what's going to happen. And then the procedural memory, it comes out of these green regions right here and right here, right? So different areas of the brain give, the memory, different memories reside in different parts of the brain, and that's important for us to remember, right? Now, this is at the brain level, but what about the cell level, right? What happens there? And a lot of these things that I'm telling you, are really major scientific discoveries. Like this is almost a Nobel Prize winning discovery. So brain cells, they connect to one another by these connections called synapses, right? These are connections between two brain cells. When you form a short-term memory, these brain cell connections become stronger. So the existing brain cell connections or synapses, they become stronger. That's short-term memory. Long-term memory is that a new connection gets built. So an entirely new connection gets built between these two brain cells, right? That is what leads to long-term memory. So it's important to sort of understand that concept because a lot of therapy or treatments are beginning to be based on cellular functions. So now, in the last few years, we've been able to manipulate quite a bit of the memories and understand them even better. So this is an experiment that was done where they took a rat, which is our second most favorite experimental subject. Our most favorite experimental subject is actually the medical students because they always volunteer for our studies, right? So this is a rat. This is a container with water, and there's a submerged platform. So when you let the rat into this container, it swims around, finds the submerged platform, and then stands on it, right? Second time you allow it, it takes lesser time to find that submerged platform. Third time, even lesser. Fourth time, even lesser amount of time to find the submerged platform. It is forming memory, which is helping it get to the submerged platform sooner, right? Now, if you let it down into the submerged platform and the mouse finally finds this submerged platform, and then you take the mouse out and you inject it with adrenaline, right? We all know what adrenaline is. It's a hormone. And so if you inject adrenaline, it sort of burns this information in the memory of this mouse. So then the second time after the adrenaline injection, when you leave the mouse in this submerged, in this container of water, it swims right to the submerged platform. The memory of that submerged platform location is burnt into the brain of the mouse because of this adrenaline. Now let's think about this a little bit. When is your adrenaline really flowing in high amounts in your body? During stressful situations, right? So if you experience something during stressful situation, it gets burnt into your brain, right? So what can result from this? What we call PTSD, post-traumatic stress disorder, right? So in stressful situations, that can happen. So in a study that was done, they took an adrenaline blocking drug, which is a beta blocker, and this adrenaline blocking drug was given to people after a traumatic event, right? And they found that those individuals who were given this adrenaline blocking drug early on, right after a traumatic event, they did not develop PTSD as much as those who were not given this medication, right? So this was a major manipulation of memory for the benefit of people, right? And the last concept in memory that we need to understand is this. Kareem Nader, who's a scientist in Canada, his work essentially, and I'm going to oversimplify this, what he found was that forming a memory is like taking a file, putting it in a drawer, and closing the drawer in the cabinet, right? But when you recall that memory, it's as if the drawer is opened and the file comes right out. For that memory to then be retained, it has to be reformed. So that file has to go back into the drawer and the drawer has to be closed again, right? Okay, well, that's kind of interesting. Why is that important? It is important that because if we wanted to interfere with memory, if we can recall that memory, we are taking the file out of the drawer completely, right? And then we can block that memory so that it never reforms again, right? And so that can help in certain diseases and disorders, like arachnophobia, right? Some of us are really not comfortable with spiders. I'm sure there are many online today on this meeting who are not very comfortable with spiders, right? So a study was done where they took essentially people who were arachnophobes, they're very scared of spiders. They took these hairy spiders and they brought these people so that they're exposed. So the memory of that fear is recalled. So the file has come out of the drawer. And they gave him a medicine, which is a beta blocker, to block this file from going back into the drawer and reforming that memory, right? So I hope you guys are getting this. So they block the memory from being reformed. When they do this, right, they found that these people who were confirmed arachnophobes, they were actually sweating if from the sight of the spider. In about a few days, they were able to see the spider without any fear. And in about 3 months, they were able to hold the spider in the palm of their hands. So clearly, we have learned a lot about memory, and we also know how to now modulate memory for the benefit of our people. Now let's move on to the disorder of memory, right? The main disorder of memory is called dementia, right? So what is dementia? So dementia is not just memory loss, it is memory loss plus one other thing, either language dysfunction or problem with calculation, problem with orientation to time, place, and person, judgment. Some of another cognitive skill is also damaged, right? So at least loss of 2 or more domains of cognitive loss is what this is. Now, anyone who has memory loss and dementia, it is recommended that every single one of them must have this basic test. Because if we find, this is how you find reversible causes of memory loss. And if that is the cause, then we can easily reverse that, right? So the basic workup is some blood tests, but it should look for thyroid, in addition to that, thyroid function of the thyroid hormones, vitamin B12 levels, and then for neurosyphilis. So essentially, 5 tests that need to be done, 5 blood tests that need to be done to really to determine that there's no reversible cause of memory loss. Because if there is, these can be easily corrected and treated. I'm just showing you this to tell you that there are different criteria that are being used for definitions that people will. Most places will use some cognitive tests to determine if someone has dementia. One of the commonest ones is this mini mental status exam, which is a bunch of questions and drawings that a patient will be subjected to, be asked to do. And based on their responses, we can get a value which can tell us if the person is demented or not. Now, in dementia, 50 to 75% are Alzheimer's dementia, and we'll talk mainly about that. But the second most commonest kind of dementia is vascular dementia, which is essentially tiny strokes that happen, a ton of them happen in your brain, and that's how you develop that kind of dementia. So Alzheimer's, this is a progressive brain disorder, and essentially an abnormal protein collects in the brain, which causes brain cells to die, right? So abnormal protein collects in the brain progressively, and because of this collection of abnormal protein, brain cells die. And when brain cells die, you develop memory loss and dementia. That's what's happening here, right? It can be accompanied in Alzheimer's, particularly with behavioral problems, and that sometimes is an even bigger problem than just memory problems in Alzheimer's dementia patients. So that is there. And there will be decline in functional status in these patients, right? As I told you, big economic strain here in the United States, was across the world in trillions of dollars. It's the 6th leading cause of death in the United States. And that number, it's one of those causes that's actually not being controlled in terms of cause of death and disability. This is the deeper the color, the more the incidence of Alzheimer's in the map of the United States. And especially places where people go and retire, like Arizona and Florida, you'll see a larger number of them, right? Why is it important, significant, right? More chances of people with Alzheimer's will get hospitalized. In the United States, almost half the people living in nursing homes have Alzheimer's, right? And there's a new case worldwide every 4 seconds of this kind of dementia, right? So the dementia is an important entity and has great costs, not just for the family, but also for the nations. The number 1 risk factor is old age. So old age is the number 1 risk factor for Alzheimer's. That's not something that we can modify. And there is no difference between incidence in men and women. It's a 1-to-1 ratio that you will have, right? Now, what causes this? You have, if you were to section the brain and check what's abnormal, you'll find this abnormal collection of protein, the amyloid protein that collects in plaques in the brain. And you also have these tangles. So you have plaques and tangles in the brain of these patients. So the idea here is that how does this abnormal protein get formed, right? So abnormal protein gets formed by certain enzymes, there's production, then that kind of aggregates together, collects together, it forms the amyloid plaque, right? This amyloid plaque then results in brain cell death, which results in dementia, right? So if we have to treat dementia, if we can stop at one of these steps, either in production or in aggregation, collection of this abnormal protein, or if we can clear out this abnormal protein, right? Those would be areas where we can have treatments here through this. Now, I wanted to kind of spend some time on this one because there is no absolute answer to this question about whether my forgetfulness is age-related or is it a sign of dementia. But here's the National Institute of Health's sort of criteria that they use. So age-related forgetfulness is like making a bad decision once in a while. Sign of dementia is making poor judgment and decisions a lot of the times, right? So they can't handle their affairs at all, through that process. Missing a monthly payment, that's an age-related forgetfulness thing. In fact, some of us may forget to do that. Problems taking care of monthly bills, inability or real problems in taking care of monthly bills persistently, that's a sign of dementia, right? Forgetting which day it is and then remembering it a little bit later, that's age-related forgetfulness, right? But losing track of date and time of the year, that is a worrying sign, possibly dementia. Forgetting which word to use sometimes, that can happen with age-related. Trouble having a conversation at all and having persistent difficulty in having conversations, that could be a sign of dementia. Losing things from time to time, that could be age-related, but misplacing things very often and being unable to find them, right? That becomes a worrying sign for dementia. Now, again, there's no absolute criteria here that if this happens, that person has dementia. But if someone does have the features in the blue side, then it is important that they talk to their primary care physician first about this. And can you prevent dementia? There is no evidence, strong level 1 evidence that we can prevent Alzheimer's, right? We don't have that. There are correlational studies that show that if you maintain a healthy lifestyle and you pursue cognitively challenging activities, you could help with that. But for vascular dementia, yes, that you can certainly prevent by managing high blood pressure, diabetes, exercising, eating nutritious food, stopping smoking, limiting or eliminating alcohol intake. All of those are for vascular dementia. This is what vascular dementia MRI looks like. You have all these tiny strokes in the brain, and that eventually leads to vascular dementia, right? And blood pressure is one of the top reasons why, high blood pressure is one of the top reasons why people develop this, the other being diabetes. And so measuring your blood pressure regularly and keeping it within these parameters is important. It is really good to discover that you have high blood pressure. If you have high blood pressure, the important thing is to discover that you have high blood pressure. And that can be done by monitoring your blood pressure regularly, especially in the elderly. And if someone has high blood pressure, it is important to treat it because once it's treated, you can prevent all of these effects, right? So not just these strokes and dementia that you can prevent, but also heart attacks and heart failure. So that's why monitoring of blood pressure is so highly recommended. And in India, particularly in some of the numbers that I'm seeing, the majority of people who have high blood pressure are not aware that they have high blood pressure because we don't have the annual physicals where you get these things measured. And so it's more of an issue there than here. So in an MRI of your brain imaging, what do you find? You find, you'll have shrinkage of the hippocampus. Hippocampus is one of the first regions that gets damaged in Alzheimer's dementia, right? That's why your memory gets affected. And because it's the hippocampus, you might remember what you did when you were 16 years old, during a school function, because that memory has gone out of your hippocampus into the other parts of your brain. But you would not remember what you had for dinner last night, right? So that's the kind of things that we are talking about. There is now another imaging study called the PET scan, by which we can actually see the amyloid. The orange here is all amyloid. So we can actually see this now. At least in this country, we do this, and it's a very good test for Alzheimer's. Now, what about some of the tips for living with early stage dementia? In the late stage dementia, they're very dependent completely. But in early stage dementia, it's important to declutter and get rid of extra stuff, right? Remove items that you can trip over, right? Install an automatic shut-off switch on the stove so that if they forget to switch it off, it can get switched off by itself. At least in this country, we recommend set the water heater at 120 degrees so that you don't get burnt, improve bathroom safety, add non-skid mats and stuff that you can do. Carrying ID, medical ID bracelets, because if they forget and go out of the house, at least someone can help them back through this, right? Getting safety devices and alerts like emergency call buttons and fall monitors, those kinds of things can happen. Make sure that you have smoke and carbon monoxide detectors, because if they forget to switch something off and it burns and there's smoke, at least it'll be picked up. Get help with home maintenance and organization, through this, and get your legal and financial matters in order. So those are some of the things that the family and the patients can pay attention to and really work for. Common sense and advice here. Now, what is the treatment? So the treatment till very recently was just this. One of the things that happens in Alzheimer's is this chemical called acetylcholine. It gets decreased in your brain, right? So less acetylcholine in your brain. Where is acetylcholine released? It's released in the synapse, the connection between brain cells. And how does it get eliminated from the synapse? What breaks it down is this enzyme called acetylcholinesterase. So almost all the medicines that we had till a couple of years ago was just agents that inhibited this enzyme. So you cut out this enzyme, there's more acetylcholine doesn't get broken down, so more acetylcholine in the synapse. That's what it is. But when brain cells continue to die off, it doesn't prevent that brain cell death. And so the effectiveness of these medications was not very high. We still recommend in the United States that they be used, but their effectiveness and benefit is not very high. There's some European countries which are iffy about using them even. So that's where we were with this, right? Memantine is another agent that is used here in this country and across the world. Now, the other thing, currently what is important is this amyloid plaque, if you remember, you can clear it by an immunological therapy, right? By an immune mechanism. We can clear this. So medications, which are monoclonal antibodies, immune therapies, essentially you inject them into the body, they go and stick to these amyloid plaques, and then they initiate our own body to attack this complex. So they go and attach to amyloid plaques, and our body just clears out this amyloid. And you can see the orange is amyloid here, right? When you give these monoclonal antibody or treatments, these new IV infusion treatments, you can see that it cleans up the amyloid in your brain from this. Now, one of the problems is that by the time you get diagnosed with Alzheimer's and you show, clear signs of it, a number of your brain cells are already dead. And so the dead brain cells cannot be brought back, right? So that's one of the things that is happening through this process, right? So one has to sort of remember that. But it's not without any side effects. You can have some micro bleeds. You can have some swelling of the brain can sometimes happen. Not very commonly, but it can. And so that has to be kept in mind. There are two medications that have been approved. One is this lecanemab, the other is donanemab. This one just got approved a few months back, but this gives great hope because it's actually preventing brain cell death by removing these amyloid plaques through this process. So the future definitely looks brighter in terms of treatment because we have these therapies. And just within the last several months, we have a blood test which can be done, and that has a high level of accuracy in determining Alzheimer's, right? So it's a regular blood test that can be done. Now, before you guys go and talk to your primary care, this is all very recent information. The neurologist would likely know this. I'm not sure that all the primary care doctors would know this. Now, I wanted to share with you this, which is essentially every dot here is a new treatment for Alzheimer's and dementia that is under trial right now here in the United States, right? So there are more drugs in trial for treatment of Alzheimer's than any other neurological disorder, right? So that's very hopeful as a sign here. And then in the end, I just wanted to tell you some of the things that have happened like within the last year, right? And that's how fast this field is advancing. So all of you have heard about, I'm sure have heard about AI or artificial intelligence. There is an artificial intelligence algorithm that was used to just go through medical records of patients, the electronic medical records, the EPIC that a lot of you must be familiar with as you go to your doctors. This algorithm just went through patients' medical records in EPIC, and they were able to pick up Alzheimer's 7 years before clinical symptoms became evident, right? So really picking them up very, very early, which is important because then we can save the brain cells from dying. And then this was a study just done a few years ago, which is kind of interesting. They took an animal model and they found that once the brain waves in the gamma frequency, which is 30 to 100 hertz, if that brain wave pattern is enhanced, what happens is that the brain, the cells, the brain's, one of the types of brain cells called microglia, just eats up all this amyloid. The abnormal amyloid in the brain is eaten up and cleared out, right? You just have to increase the gamma frequency of brain waves, and it leads to clearance of all this abnormal protein in your brain, which causes Alzheimer's, right? But how do we increase the gamma frequencies in your brain? In the studies done in this country and other countries, we have found that meditation certainly increases your gamma frequencies. And some of your pranayama techniques also increase this. So obviously, we don't have a direct study showing meditation or pranayama lessening Alzheimer's, but we are planning to do this study in collaboration with our colleagues from India, where this is more readily done, to see whether it can. But it would be a promising entity there. All right. I will stop here, and I will be happy to take any questions that you all have. And as Selena said, if you would put it down in chat, we can take them one by one.
All right, thank you so much, Sanjay. That was a really informative presentation. So there are some questions in the Q&A already lined up. Sure. So we can start with those. So the first was, all right, so I turned 55 years old recently and have a family history of Alzheimer's. From my father's side, I worry about developing serious cognitive deficits and issues later in my life. What symptoms should I watch out for? And is there something I can do to delay or take care of these symptoms?
Yeah, so in Alzheimer's, as I said, there is no really good study showing prevention of Alzheimer's, right? But the genetic basis of Alzheimer's or genetic basis of dementia is, it is not a necessity that if your dad developed it, you will develop it too. If the family member developed early onset dementia, like before the age of 50, those are generally have a higher incidence of genetic abnormalities. And there we can do genetic testing to really test whether you have that susceptibility or not. So that's one. You can do genetic susceptibility testing in that. Now, obviously, we also have this blood test where you could get a blood test and it'll tell you with high degree of certainty whether you are developing Alzheimer's or not. We also, have the AMyVid PET scan that can actually show you whether you have amyloid in your brain or not. So now, just within the last few years, we can do a lot. Prior to that, we couldn't do much at all, unfortunately. But now there's a lot of other things that we could do to really help you with Alzheimer's.
There's a question in the chat. Are there recent effective medications for vascular dementia?
Yes, so vascular dementia is much more treatable because it's like stroke. So we treat the stroke. So the best thing you can do is manage your blood pressure and monitor it regularly. Manage your diabetes if you have that. Stop smoking, right? Limit your alcohol intake, if not totally eliminate that. Exercise, keep yourself active. All of these activities, manage your cholesterol. If it's high, you should be on medications for it. All of these things will decrease the incidence of vascular dementia or stroke in you. So there we can. Medications, we can put you on aspirin or aspirin-like drugs, and they can prevent further incidence of those small strokes and prevent vascular dementia.
Another question, it's a question about the beta blockers. Does the blocking of physical symptoms contribute to how the reforming is stopped?
So beta blockers are essentially given mainly for high blood pressure, right? So it's a very common medication that we do use in this. The idea there is that the only side effect of beta blockers would be that they can drop your blood pressure. So in the limited studies that I talked about, they were younger people where this was done. And so they used a very high dose and they were just fine. It didn't really affect them much. But other than that, they don't really have a lot of a one-time use of a beta blocker doesn't have many side effects to be concerned about. But I wouldn't recommend trying to do this on your own. I would say get medical opinion before you try any of this.
There's a question related to diet and helping dementia. So the specific question is if keto or fasting can help, but I think I could just turn that into a general question. Is there a specific, nutritional guidance to help with dementia?
So the only one where it does help is with vascular dementia, and there, just low-fat diet is going to be helpful. There is some evidence that Mediterranean diets are useful in that. The keto diet, it's a pretty extreme kind of diet, and you're actually eating fat. So keto is restricting your carbs and giving you a lot of fat. That is not good for prevention of stroke or dementia. Keto diets, and the original name is ketogenic diet, was developed for children with very bad epilepsy. And they were fed fatty food with no carbs at all. And there is improvement in their health. But it is, that kind of extreme diet, I'm not sure is very useful for preventing strokes or dementia. It actually would have a negative effect.
Are the chances of developing dementia higher in elders suffering from Parkinson's?
So very good question. So in patients with advanced Parkinson's, they can develop dementia. They do develop dementia in a number of those patients. And that is a different kind of dementia than Alzheimer's dementia. But that is, and that is similar to what we call Lewy body dementia. That's the Lewy body is the abnormal protein. Just like amyloid is the abnormal protein in Alzheimer's, Lewy body is the or alpha-synuclein is the abnormal protein in that. And it's a different kind of dementia, and it has different kinds of treatments. We don't have many, but a drug or so is utilized there. And it is much less well studied because it's not as common as Alzheimer's is. And so we need to do a lot more work in that kind of dementia.
Are there mental or cognitive exercises that can be done to maintain the plasticity of the brain and possibly preserve memory function and sharpness? If so, do you have any specific examples?
So there is no level 1, which is the most rigorous scientific evidence uh, for any kind of mental exercise that can prevent Alzheimer's dementia. There is none. There are correlational studies showing that if you have higher intellectual abilities and you constantly indulge in intellectually challenging exercises, there may be slight delay in the dementia onset, but those are only correlational. There's no causal relationship there. So really, it's very difficult for me to recommend any specific kind of exercise. The only thing that I am that I would say has some causal effect to it is meditation. I think there we know meditation increases gamma waves. We know when gamma waves increase, brain cells clean up the amyloid. So we at least have this indirect, effect there. So that is what that I think it can be done. The other thing with meditation is it's also known to decrease your blood pressure and maintain it. And so that would be beneficial for this other kind of vascular dementia too.
Can you comment on the correlation of hearing loss in elderly and dementia?
Yeah, so one of the things that we generally always test is if there is hearing loss, we want to make sure that the cognitive deficit is not just coming from hearing loss, right? And so we would correct that and then see if the person improves substantially, or if they do not, then we would further investigate for dementia. But if it clears up all the cognitive deficit, because if you can't hear, a lot of cognitive domains can get affected. And so one has to be careful there. One has to rule out that the deficits and cognitive deficits are not just from hearing loss. And so that has to be corrected and then seen. The other thing is depression. That's another thing that we always look for, because depression can sometimes manifest or can mimic dementia, right? And so treatment of that is essential before we go there. Now, obviously, at least for Alzheimer's, which is the commonest kind of dementia, we have tests that can actually tell you that this is Alzheimer's, from there.
Are there tips for supporting elderly parents with dementia, especially if they're in India? And if you're here in America, and maybe I'll extend that question to just be, are there any specific trends that you're seeing within the Desi or the Indian community? Especially since you mentioned that there's a couple of things like meditation and pranayama that can help.
Yeah, so they can help before you actually develop these things, or in the early stages. I'm not sure how much they would help after someone's developed dementia, so or at least late stages of dementia. So clearly, as I said, some of the common sense things have to be taken into account. By you clear the home environment, make it more conducive to them, give them medical IDs, because a lot of times some of these dementia people with dementia can walk around, can leave the house, so there must be a way of getting them back. So some of those things are utilized through this. Having those devices which can switch off a stove or on the gas, and those kinds of things. So I think that slide of mine where I went through this, I think that is something to keep in mind. Now, every home has unique, situations. And so the idea is to do this in a common sense way. So to have backups and to keep them as safe as possible, especially during their early stages of dementia. In the late stages, it can be even more challenging through this. And if you can get sitters or home help, that can be certainly helpful, particularly in the Indian context where you can have that. And there are elder care, companies now in India that can help you with some of that treatments and some of that care.
There's a question. Can the extent of dementia be measured? So is it possible to know that if a patient has progressed to the maximum level or is somewhere along the spectrum.
Yeah, so we can definitely classify them into mild, moderate, and severe dementia. And we do cognitive testing, and that can tell you. Neuropsychologists can do that cognitive testing. Some of that cognitive testing is just done by the neurologist. Yet there, in India, in the Indian context, it's important to remember that there is a huge shortage of neurologists. Till just a few years ago, we only had a few thousand neurologists for the entire nation of India. And we were only producing less than 100 neurologists a year, in that context. So it is outside of the metros, there is quite a bit of shortage of neurologists. So because of that, a lot of the primary care physicians, have taken on the care of these patients. But now, with the government's work and the work of medical societies, they've actually enhanced some of that care within India too.
A follow-up on the tips question. So do you have any suggestions on managing the interpersonal aspect when you have a relative with dementia? So for example, if they're in denial or argumentative?
Yeah, so there are behavioral and psychiatric comorbidities. So a patient with Alzheimer's is very likely to develop behavioral effects. So, they can have hallucinations, they can have delusions, they can have behavior issues, and it is really important to treat those behavior issues, right? They are treatable, medically with medicines, they are treatable, and they enhance the quality of life of the person with dementia. And so that is really important to take that into account. If you're seeing a lot of that in an Alzheimer's patient, here in this country, we have geriatric psychiatrists, and that's where we take them. And that field is basically meant for that management. But there are just one or two, there are a couple of medications that have been extensively studied, easy to administer, it's a pill a day, and that'll help them out substantially. And so it's very important to take them to an appropriate physician to get them treated for their behavioral and mental health issues.
Can any supplements like omega-3 or B complex help in dementia?
So if someone has vitamin B12 deficiency, then the vitamin B12 will help, right? If they don't have a deficiency, then there's no point in that. Omega-3 will help with vascular dementia because it helps, sort of maintain good vascular health of the individual. So it will not only help with strokes, which cause this vascular dementia, but also with heart disease and other things. So that is advisable in that case.
Dr. Sanjay, may I just ask you a related question here? In India, we do have this Chyawanprash and ashwagandha and all those Ayurvedic medications, right? Very readily available for our parents. So do you think having some of those would actually help them help the memory in any way, apart from the omega-3s and other things that you're talking about here?
Yeah, I mean, all the omega-3 does not directly help with dementia. It just helps with preventing strokes in some ways, with good vascular health. That's about all that we know. Now, it may have other benefits, but I'm not a practitioner of Ayurveda, so I'm not very well qualified to comment on that. And that's why I always restrain myself. But I am not aware of good randomized controlled trials in dementia showing any benefit of those kinds of things.
Okay, thanks.
There's a comment in the chat about you might be able to see an OT to get a quicker,
Sure.
A cognitive test and assessment.
Yeah, the neuropsychologists in India are certainly in short supply. In this country, there are wait times, and that is certainly the case. You might have even longer wait to see a neurologist in certain parts of the country. In fact, even in the United States, we are now using the terminology of neurology desert zones, potentially, where you might not have them outside of populated areas. So But yes, neuropsychologists, and more of them are getting trained. So they will be available. They can do this. It's to assist the neurologist in making this diagnosis. But the neurologists have their own tests that they can do to really confirm this from there. It's not a requirement to have a neuropsychological testing. It does certainly help because they do more detailed testing, but it's not a requirement.
What's your best advice for a type 1 diabetic in her 40s?
I think management of your hemoglobin A1C is going to be the best thing for someone to do. As long as your hemoglobin A1C is well managed, you should be fine from there.
Any concerns with eating 2 meals a day? That's sort of a dietary pattern. Does that affect memory or brain function?
No, we have no evidence that would, as long as you're eating healthy food, there's no evidence that it would in any way undermine your memory.
Does dementia also accelerate hair loss?
No, nothing that we know of today that would correlate the two.
Any linkage of high A1C with dementia? I think you had mentioned that there was.
Yeah, so high A1C, certainly would lead to more of vascular dementia because it's a risk factor for stroke right there. There's some early work that's looking at that dementia or other neurodegenerative disorders may have a component of abnormal insulin metabolism within the brain, but that's all in the realm of research right now.
For a diabetic who recently turned 40 with a history of diabetes, high cholesterol, heart problems, is there anything that somebody can do, or recommendations to prolong or delay onset of Alzheimer's?
Yeah, so Alzheimer's is not directly related to heart disease in terms of a causative relationship. It's not. I think the vascular dementia would be more of a concern with diabetes, high blood pressure, and heart disease, as an entity. And so there, the recommendation would be to maintain your hemoglobin A1C, control your blood pressure well, and then take the medicines for heart disease. There is no evidence that just because you have heart disease, you're definitely going to develop Alzheimer's in any way.
So yeah, there are 2 questions on the chat as well from Dhruvika, I think. Are the chances of developing dementia higher in elders suffering from Parkinson's?
Again, could you repeat that?
Are the chances of developing dementia higher in elders suffering from Parkinson's?
So Parkinson's does have, as part of the spectrum of Parkinson's disease, dementia is something that you develop in advanced Parkinson's cases. And so clearly it's a different kind of dementia than Alzheimer's dementia. It's a subcortical kind of dementia that is there. And the treatment for that is somewhat limited because we haven't studied it in as much detail as we do with Alzheimer's at this point. But one of the things to do there is, in addition to addressing dementia, is to really properly manage the Parkinson's.
All right, so I think there's also, I'm trying to summarize this one. How is dementia related to anger issues?
So there is no correlation in that sense. People with dementia can develop mental health issues and behavioral problems because of dementia, and then that is treated by medications and it can be managed to a very great extent, and that really improves the quality of life of these patients. So it's important to pick that up and get it treated.
If someone has had like a physical accident that resulted in neurological issues, does that, or could that result in memory loss or dementia? down the road?
So if it has injured parts of the brain that are responsible for memory, then it can certainly result in memory problems. If someone has, like football players, if they have repeated injury to the head, right, that can lead to a condition which we call CTE. And that is very much like a dementia, but that's a separate spectrum of disorder that does take place there. But that's through repeated head injuries, that happens from there.
Are sugar or salt levels related to dementia, developing dementia?
Now, the salt, excessive use of salt is certainly a problem if you have high blood pressure. You really need to eat vegetables and fruits more than, and really a low sodium diet in people with high blood pressure, because if uncontrolled high blood pressure can lead to vascular dementia. So that's how that would be related. Sugar too, I mean, if you have diabetes and your sugar levels are high, then you're at more risk of developing these vascular dementia and those tiny strokes that collect over a period of time and you develop dementia.
And Dr. Sanjay, can dementia be measured? Like, for example, is it possible to know that a patient has progressed to the maximum level of dementia?
So, dementia can certainly be measured in terms of mild dementia, moderate dementia, severe dementia. So yeah, there are ways through cognitive testing that we can do that. Now, soon now that we have imaging that can show you the amyloid in the brain, we would be able to classify it from that perspective too.
Thank you.
Okay, I think there's one last one here. So for an elderly mother who stays alone in India, if she seems depressed or losing her temper easily, refuses to see a doctor, would these symptoms point to early onset of dementia or memory loss? And if so, how do you approach this subject with her to kind of convince her to see a doctor?
So the first is obviously if she is depressed and is having some of these issues, what we generally recommend is first seeing your primary care physician, right? In this country, we would have you see your primary care physician so they can tease out, what are the medical problems. And then if there is a component of depression, then psychiatrists could be involved in India and they can treat it, or sometimes primary care doctors can treat it with medications. It's an easily treatable thing. It just needs to be picked up. And if treating that does not result in reversal of the cognitive deficits, then they would proceed in their own direction there. But yes, I mean, seeing a doctor is going to be important. And I think the idea is to say, is if this is a medical issue, and all of these are medical issues, right? And so if it's a medical issue, we just need to get it diagnosed and then we need to get it treated. So then you can, carry on with your life. Addressing it in a very matter-of-fact medical fashion is much better in all contexts, and particularly in the Indian context. Yeah.
Can painting or artwork help in cases of dementia?
Any intellectually challenging thing has been shown to be beneficial. Now, beneficial, I would put in quote unquote. It doesn't show that it decreases brain cell death or that it reverses dementia in any way. But it doesn't harm. It's certainly helpful from that perspective. There's some correlational studies showing intellectually challenging intellectually challenging activities decrease the rate of decline in these people. But more interestingly, there is a type of dementia called frontotemporal dementia, which is a rarer form of dementia. Some of those people who develop that kind of dementia can turn into painters, really phenomenal painters. So it's just, the fascinating aspects of the brain. So essentially, there's a patient story where there's a high-level executive, develops this frontotemporal dementia, can't balance his checkbooks, really doesn't recognize people very well, is put in a nursing home. in most nursing homes, they have this activity of drawing and painting because you don't require a lot of supervision for that, and it's a safe activity. So they essentially tell the people there that Grandpa Joe couldn't paint if his life depended on it, right? And so could he not paint? And they said, no, that's the activity. Everyone does it. He has to do it too. And so after a month, they call in the family. The family's very worried when you get a call from the nursing home. And they go in and he says, what did you tell me about the painting? And they said, oh, is he causing trouble? I told you he'd cause trouble, right? And they said, no, he's not causing trouble. And he shows them these beautiful landscapes that he started to paint. And then the family goes back to the doctor. He says, I think you misdiagnosed the person. He's like he's getting demented, turning into a painter. And they said, oh yeah, I forgot to tell you. In this rare kind of dementia, as they get demented, some of them can turn into painters. And so it's essentially when one part of the brain stops functioning and another corresponding area of the brain can start to function better. So it sort of releases these genius-like activities sometimes.
Okay. All right, we'll take one last question. Is there a correlation between liver issues and dementia?
So if the liver is malfunctioning, it can release certain chemicals that can cloud your cognitive abilities and memory. And so treatment of that liver issue is important there. We call that, we don't call that dementia, but we call that encephalopathy. It's essentially liver causing problems with the brain because of the chemicals that are released from the liver, or some of the things that cannot be metabolized by the liver, they can go and cause harmful effects to the brain.
Great. All right, I think we just got through all the questions.
Just came in.
Did another one just come in?
On the Q&A.
Okay. All right. I'll just read this one. When my grandmother used to go to the market on her way home, she would go to the homes of other relatives, mistaking them for her own. This continued for a long time until one day she began to believe the grandfather was her son, and then for the following few months called him by the father's name, and then would struggle to put it in perspective when they informed her that it was not his son, but eventually she would accept and recall that it was her husband. Am I missing?
So I guess the question is this kind of dementia issue? I think that's what the question was. Okay, I don't see a question there. Was it a time? Is there a word limit on the question? So after this.
Yeah, so in that kind of circumstances, could it be dementia? It could be. It could also be a mental health issue. So that's where, actual evaluation by a physician would be essential to tease that out.
Okay. All right. Well, I know we're at the top of the hour. So I just wanted to thank you, Dr. Sanjay, for your time and this excellent presentation. Thank you, everyone, for your time this evening. I think there's some questions about the next event. So after this webinar, you'll receive a sort of a post webinar email in the next day or two. It'll have some follow-up information in terms of both information on Family Pro Health as well as Desi Daughters. We both have webinars scheduled for next month, so you can follow along on our sites to get more information on future webinars. And with that, thank you so much for joining us, and I will close it up.
Thanks, guys, again. And please send us emails as well. And if you have any further follow-up questions, the email that you will receive has our email addresses as well. So please feel free to send us emails, and we'll try to get up to Dr. Sanjay to answer some of them at least. Okay. So let's continue the conversation here. Thank you, guys. Yeah. Bye then.
Thank you.
Bye. All right. Thanks, Dr. Sanjay. Bye, Serena.
Bye.